Thank you all for joining us today. My name is Diane Rollman. I am the director of the Healthier Workforce Center of the Midwest. It is a NIOSH-funded Total Worker Health Center of Excellence. I'm located at the University of Iowa, and we partner with colleagues in St. Louis at Washington University, at Kansas, and Nebraska here. And last year, we hosted a webinar on recovery-ready or recovery-friendly workplaces. And in that webinar, we talked about the problem of addiction and what can be done in the workplace to support workers in recovery. And that introduction is available. It's on the screen here with the QR code. And there's also other resources that we've developed during the past year, including a workplace policy brief, which is just a one-page document, and also different podcasts on a range of topics. So these are resources that are available, and you're welcome to use those in any way. We also, one of our research projects in the center, led by Dr. Anne-Marie Dale, was focused on developing employer guidelines for employers in the construction industry. And the goal was to focus on prevention of opioid and substance use disorder, specifically in the construction trades. But I think the information that's contained in there could be relevant to many other workplaces. But after we had done this work and we've started promoting different initiatives we realized that people are interested in making changes in the workplace, but they don't know where to start. And that's why we're hosting today's webinar, which is focused on the Recovery Ready Toolkit, which was developed by the Department of Labor. So today, I'm excited to have our presenter, Peter Gaumond, who is the chief of the recovery branch in the Office of the National Drug Control Policy. He has over 30 years experience in substance use disorder treatment and the recovery field. He joined the Office of the National Drug Control in October 2010. And at that point, he was the chief of the recovery branch, and he currently serves as a senior policy analysis supporting the Office of National Drug Control, Office of Public Health. I hope I got all your acronyms right, Peter.
Yeah.
Close enough.
It's wordy, it's government,
Yeah. So Peter provides expertise on a wide range of public health policies and regulatory issues, including recovery support services, peer-led organizational infrastructure, employment for people in recovery, and probably most important is stigma reduction. And he was involved and helped to frame the government's initial approach to improving long-term recovery outcomes, including the development of policy goals. And as you know, when we think about solutions, those policy is really important because that's going to have the greatest impact. More recently, Peter has led the development of the Recovery Ready Workplace Hub, which you can see the link here, and I'll put it in the chat. This is an online repository of resources available for employers, state, and local governments, hosted by the Department of Labor. And it also houses the Recovery Ready Workplace Toolkit, which is available through the hub. And he also provided input into the development of the Recovery Ready Workplace Model State Act. So today we are excited to have Peter provide an overview of the toolkit and other initiatives, and I am going to turn it over to Peter. Thank you.
All right. Thank you, Diane, and welcome to everybody. Thank you for taking the time out of your day today to join us. I noticed a couple more familiar names joining this webinar, so welcome friends and colleagues. Can you let me know if you can see my slide deck at this point?
We can see the slides. You're not in presenter view yet.
Yes, thank you. All right. And now.
This looks great. Thank you.
So again, let me thank both of you for reaching out and making this possible. I can't tell you how excited I was to see that your center is actually awarded grants to support the development of recovery-friendly workplace policies. So I look forward to learning more about that, and I hope that what I have to share will be helpful to everyone joining today. I see we have 90 minutes. I'm not going to need 90 minutes to cover this territory, so we'll have ample time to discuss. And I think that's where we may have the I may be able to get down to the specific questions and issues individuals have. I see a hand up. Kevin, did you have a question or comment? No. Okay. So go on to the next slide. So in today's session, I just want to first start by talking a little bit about how this came about, and that requires, for those of you who aren't familiar with this office, talking a little bit about what the Office of National Drug Control Policy is, a very brief look at relevant segments of the National Drug Control Strategy, which coordinates the executive branch's activities to reduce the consequences of drug use nationally, to reduce drug use and its consequences. And then more specifically, I want to look at our federal work, some of the materials that we've developed, and what we're doing within the federal government to start to become recovery ready as well. And I want to take a look at the current terrain, what we see out there, and then we'll have plenty of time for question and answer discussion. I do want to say you'll hear me refer to recovery ready workplace policies. We see that as synonymous with recovery friendly workplace policies. I've seen a few other designations out there as well. And if you look at, as long as they include these different policy components, we're going to see those as synonymous. The QR codes will bring you to additional information on the topics on the side. So what is the Office of National Drug Control Policy? Some of you are probably familiar with this. Some of you may have heard of the Drug Czar or the Drug Czar's office, or the unfortunate but all too real, quote unquote, war on drugs. What we do is we work across all the different federal agencies. We are a component of the Executive Office of the President, like the Office of Management and Budget, the National Security Council, the Council on Economic Advisors, the Domestic Policy Council. So these different extensions of the White House itself, and we're situated here rather than being a freestanding agency because we need to coordinate on behalf of the administration policy, whether it be in Department of Labor, Department of Education, HHS, Homeland Security, Justice, you name it. We're working across the departments to try and ensure that our policy goals are well articulated, are coordinated, and that we work across the different agencies to implement them. So how do we do that? We do that by developing the National Drug Control Strategy. That used to come out annually. It now comes out every other year since our last reauthorization bill. The National Drug Control Strategy is the President's action plan for addressing drug use and its consequences. And here we technically coordinate implementation across 19 federal departments and independent agencies that are deemed part of the drug control budget, but honestly, we work with a much larger number than that. These are the ones that have sufficiently germane activities that they've been a portion of their budget has been designated as part of the drug control budget. That budget is anywhere from $43 to $46 billion, depending upon when you're looking at it. What the current appropriations are. What does that mean? Is that a separate pot of money? No. What it is portions of the different agencies' budgets that are deemed to be supporting the national drug control activities. So a substantial portion of the Substance Abuse and Mental Health Services Administration, of course, I bumped a key, smaller proportions of other agencies, law enforcement, Coast Guard, Navy, etc. So you're getting into international interdiction, State Department. So it's across the government, different kinds of agencies that we work with. So we're unique in that we're not simply a public health agency. We're not simply a law enforcement agency. We're not simply an international relations agency, if you will. We kind of have a little bit of all these components going on. So the strategy provides a comprehensive approach to addressing the problem presented by drugs, opioids especially, but methamphetamine, cocaine, other drugs. It does not address alcohol use disorder per se, unless it's co-occurring with a drug use disorder, for the reason that our statutory mandate is limited to illicit drugs. So that would not count for alcohol, and we have a shifting terrain with respect to THC and cannabis in the current environment as well. So saving lives is the North Star, particularly in the context of the opioid crisis, where we have been losing over 100,000 people annually to overdose, principally driven by fentanyl in the drug supply. So that has been critical. What has been remarkable in the current administration are two things. One is, as you see here, in addition to prevention and early intervention, we now have harm reduction as a formally acknowledged component of the drug strategy. While there was some federal funding for harm reduction activities in various locales, this was never mentioned. It was always a sensitive topic. In the context of the opioid crisis, we needed to move beyond that. So there is a chapter in the strategy devoted to that. Recovery, since 2010, when I first joined here, we had a totally different organizational structure at that point. I joined as the chief of a new branch. We had an Office of Demand Reduction, which did everything public health, and an Office of Supply Reduction, which did law enforcement, interdiction, and so forth. The Office of Demand Reduction at that time had two branches, prevention and treatment. So I came on to head up a new branch, the recovery branch. And this was the first time recovery was formally identified as a goal. And we started framing what it looks like to support recovery as something distinct from treatment per se, or from harm reduction for that matter. So that's really significant. But this strategy is the first one we've had a full chapter on recovery as well. So it's been pretty gratifying to have been pushing for this number of years, and now to see it coming to fruition, which means I'm very busy these days as well, which is also not a terrible thing. Get this slide to, there we go. So one of the key things, since saving lives is one of the overarching concerns, a high profile initiative we have right now is the White House Challenge to Save Lives from Overdose. This is a nationwide call for employers, institutions, academic institutions, you name it, to take this challenge, which is essentially to ensure that naloxone is available in the workplace, that employees are trained in its use and are trained in the identification of potential overdose and the response to it, including the administration of naloxone. We, in fact, have an event coming up at the White House in about 10 days or so around this. And we recently had one on recovery-ready workplaces, which I'll mention briefly, although it's not technically in my slide deck at this point. So this is something to look at. You may want to explore this. My slides will be available to you afterwards as a PDF, and it will have links to these different initiatives. So building a recovery-ready nation, that's the header of our chapter on recovery. Part of our thinking there is that we really need to build, recovery support ecosystems, and we need to look beyond simply service systems to the broader community, to other environments such as the workplace, schools, as well as the broader community. So today, obviously, we're going to be talking about supporting recovery in the workplace. In our chapter on recovery, we identified three overarching principles with some basic actions under each. The first principle is expanding the science of recovery. And what do we mean by that? We mean when we look at the available research literature, we know a fair amount about addiction, the addictive process. We know a fair amount about various treatment clinical interventions and their relative effectiveness and for whom they're effective. Obviously, we need to continue developing that. But we know far less about the diverse trajectories that Americans take from substance use disorder to recovery or remission. We know that only a minority of individuals with substance use disorder end up in treatment. It's also a minority that end up in mutual aid groups that we are aware of as well. So what are their trajectories? What are our opportunities for helping them find recovery sooner, recovery or remission sooner? What are there milestones that we can identify in the recovery process? Are there factors we can identify, community level factors, individual level factors, cultural factors that can help us better respond and target our responses? Principle 2, make recovery possible for more Americans. One of our key goals here is expanding peer recovery support services capacity. And fostering the adoption of more consistent standards for peer recovery support services. This is one of those areas where states regulate it, and states like to recreate the wheel very often, and yet there are some validated standards out there. So we'd like to see that. It's also critically important, as I'll get into. I don't know if I'll get into it later, but I will say it now. We're looking at, when we talk about peer capacity, we're not talking just about, say, certified peer specialists. We're talking about the organizational infrastructure that supports them within the community, recovery community organizations, recovery residences, collegiate recovery programs, recovery high schools, alternative peer groups. All of these things start to provide an ecosystem in the community so that you can help people who aren't in treatment get in treatment. You could help people who either don't have access to or are not willing or able to access treatment to follow another pathway. You can support people prior to treatment, during treatment, after treatment, as we say, in lieu of treatment. So we need this infrastructure. The other reason we need it is because it starts to build social capital or community recovery capital, as we like to refer to it. So it's akin to building resilience in the community prevention model. You're building the strengths in the community that will help increase the prevalence and duration of recovery. Principle 3, eliminate barriers, increase opportunities. We're building on work undertaken in the Obama administration. We're developing guidance for all federal executive branch agencies on the use of language. We want to ensure that there's consistent, neutral, science-based, and person-first language regarding substance use disorder, and related topics. We know that the impact of stigma alone can be devastating. We know that using words such as abuse or abuser literally affects the judgments and perceptions of people. Without their being aware of it, they will be more likely to support punitive rather than public health approaches to addiction. They'll be more ready and willing to blame individuals for having a substance use disorder. The research on this is actually pretty good. And so this is something that's critically important. In addition, we need to be across these different components of government, we need to be using the same terminology and speaking to the same things in order to effectively coordinate our policy. And we're also going to be reviewing federal anti-stigma or stigma reduction efforts related to substance use disorder. Are they evidence-based? Do they appear to be well targeted? Are they somewhat ad hoc, or do they appear to be coordinated across the different efforts? And what recommendations are they sufficient? And what recommendations will we have? And finally, the topic today: expanding employment opportunities and promoting recovery-ready workplace policies. So that's an overview of what we're doing in the recovery domain. What do we mean by recovery? For some of you, this is old hat, but I think it's important to cover this ground. We work with the consensus or working definition of recovery that SAMHSA released in 2010, and which has really stood the test of time. And that definition is that recovery is a process of change through which individuals improve their health, wellness, live a self-directed life, and strive to reach their full potential. And it has 4 primary dimensions: health, home, purpose, and community. We always point out that recovery is not synonymous with either abstinence or remission, although it can overlap with them. These terms, abstinence, are defined as a negative or the absence of or the reduction of symptoms or pathology. Recovery is defined as a strength-based concept. It is defined by what it brings: improved quality of life, improved social engagement, improved health and wellness, and and all these things relate to recovery capital, which I don't think we probably have time to get into, but suffice it to say that recovery capital is the internal and external resources an individual can bring to bear to address a severe substance use disorder. Our goal is obviously to help build recovery capital, and we're now looking at it not only as an individual concept, as in the individual's recovery capital, but how can we build recovery capital at systems level, whether that be at the level of employers or communities or schools or whatnot. So recovery is a difficult concept. So I'm a person in recovery myself, a person in long-term recovery. For me, that means I haven't had to use any alcohol or drugs since 1986. The length of time is really not so relevant as the fact that I have a life today that I could not have imagined. I would have an issue if somebody said, well, you're not in recovery because you're not doing this, or you're not following that, or, well, yeah, if you take a medication for opioid use disorder, you're kind of in remission, but I wouldn't call you in recovery. Well, I don't, that's not for you to say about me or for me to say about anyone else. What do we mean by recovery? If we mean it's a process of change, certainly we must logically acknowledge that it probably didn't begin just on the last day one happened to use substances. Rather, there's, if you're familiar with Prochaska and DiClementi, if you're familiar with the stages of change, so forth, you're going to say there was pre-contemplation, contemplation, movement. That's the way this process works, and people can move back and forth. Phil Valentine, who recently retired as the CEO of Connecticut Communities for Addiction Recovery, is famous for having said, "You're in recovery if you say you are, and you are welcome," as in you are welcome here. Now, he caveated that because he said he was having lots of tough discussions with his boards, and he said, no, we can't turn somebody away because they come here high or smelling like a distillery. We can still let them be part of the community, but we're not going to put them at the front desk welcoming people. We may have them out back cleaning. We may have them doing other things, but we need to engage them. And we need to not judge who is or is not in recovery. We can't take our lenses and start excluding people. And so I think that's a key component, that there are many pathways to recovery. And so our goal from the federal government is just to embrace those many pathways and to recognize that recovery is a path, a change process. Another definition, we've started hearing it in the harm reduction context. This particular reference from the late Dan Biggs, a harm reduction leader, past harm reduction leader in Chicago and nationally, they define for their purposes any positive change as a person defines it for him or herself. By that, they mean that if I start coming to get clean works because I recognize I'm going to potentially transmit or contract an infectious disease, that's a step. If I start working to make sure I don't overdose, each of these are steps. So those steps can continue on all the way to full recovery. So recovery and harm reduction do not need to be in tension. If one defines recovery as abstinence only, then there's going to be a tension there. But if one actually looks at it as a process, then there's much more ability to bring the two together. And I think one of the things I'm excited about is seeing the extent to which the recovery community, the organized recovery community, is engaging in harm reduction and partnering with harm reduction organizations in the current setting. That is huge. That is huge. One last thing before we start moving on. I think this captures the goal in the current strategy. This is from the recovery chapter. To improve outcomes over the long term, we must recommit to shifting the focus of drug policy from punishment and social exclusion to healing and community reintegration. That is how we will begin to turn the tide, building recovery-ready communities that can effectively respond to and heal from drug use, addiction, and overdose. I'm almost ready to get us into the nuts and bolts here, okay? So another concept, as a social worker, I'm very fond of the idea of ecosystems, social ecosystems, culture. And if you look at that term, and if you look at what the ecological perspective is, it's seeing the individual, the group, the family within an environment. And that's the only way to understand addiction and recovery is you need to look at the environment in which the addiction arose, and you need to be able to start working with that individual in that environment, or working to change that environment or change environment with the individual. Yes, there's a genetic component, but like many chronic conditions, addiction emerges from the interplay of genetic predisposition and environmental factors. Cultural factors, et cetera, et cetera. All these factors can play into it. When we're talking ecosystems, just one more thing, this really emphasizes the value of peers. If I have a treatment system, that's going to be one ecosystem. If I have the criminal justice system, that's going to be another one. If I have a culture, if I live in a neighborhood, if I go to work or school, each of these are like their little ecosystems. And yet as an individual, I interact with all of these. The value of peers is you can find somebody in the community, similar cultural background, similar similar historic background, in the neighborhood that may also have involvement with the criminal justice system, maybe in recovery, experience with the treatment system. So there's a magic there where you can really start cutting across these system silos that we create with somebody who is uniquely positioned to be, was unique legitimacy as a messenger, somebody who has been in the same kinds of places you have, in the same kind of circumstances, and has moved further down the road and can speak to that. So components of recovery-ready workplace. These all emerge from the toolkit, and the toolkit itself, I wouldn't describe it per se as the Department of Labor toolkit. Rather, I would say it was developed by an interagency work group. Labor was part of that work group, and they agreed to host the Recovery Ready Workplace Resource Hub. And that's where we host the toolkit. They have been instrumental, so they're a key partner in this, but I would say it's a broader group of agencies that were involved in the development of the toolkit. As we looked at these policies, we're trying to find a way that was fairly straightforward to describe the key policies, and we came up with 4 pillars of a recovery-ready workplace. The first one is prevention and risk reduction, which anybody who is doing total worker health is going to be very familiar that that's a key piece of the landscape with total worker health. Training and education, and that will include everything from substance use disorder literacy, and we'll go into that more, as well as simple awareness of what your policies are. Again and again, we find people don't know what their policies are and are anxious and afraid to ask for help if they have an issue, even in an environment where they might have support because that hasn't been communicated. Hiring and employment. Are you hiring people in recovery? And what are you doing if somebody either tests positive or seeks help for a substance use disorder, or is otherwise identified as having being impaired in the workplace, having a substance use disorder? What are your policies? What latitude do you have also within your regulatory, your legal and regulatory environment? And how are you exercising the discretion that you do have? Because we can't magically change some of the laws and rules that are in place, but we very often have a lot of discretion in how we implement them. Treatment and recovery support. Well, for most employers, this comes down to EAP, health insurance, and in some cases, there are peer networks or company-based employee resource groups for employees in recovery and their allies. For other small organizations, who aren't able to offer this, it may be really critical for them to develop partnerships with local treatment providers, with local recovery community organizations, recovery residences, and other recovery community organizations, other partners who can help them serve their employees, and who may also be an excellent source of employees in recovery. And one of the things that we reiterate is that employees in recovery can be some of the most dedicated and reliable employees you'll come across. So, in the first pillar, prevention, we're basically looking at factors that increase the risk for substance use in the workforce, not in maybe in the workplace, but certainly in the workforce. Injury is a key one, of course. That's probably not unrelated to the high rates of substance use and opioid misuse in construction, for example. It may not be in other industries, but injury is key, and it can be everything from falls, injuries to operating machinery, or simple repetitive motion. And now if you combine that, so that these injuries may occasion the prescribing of opioids, which can increase the risk of opioid use disorder. If you combine that with an industry where individuals may not have, say, paid medical leave or paid disability leave, you get into a situation where there's a strong incentive or perhaps a need to try to take opioids or other medications in order to be able to go to work when one should be recuperating. And so that can be a particular risk factor. Stress itself can be a factor there. Erratic scheduling, excessive scheduling, unrealistic production demands, which end up being problematic for a number of reasons. You start having employee turnover, et cetera, et cetera. And a toxic culture. All these things can be factors that contribute to substance use. Alcohol policies. Does your company routinely have events centered around alcohol and alcohol policies? If so, do they have options for employees that are in recovery? Do they have non-alcoholic options, et cetera, et cetera? These are key. Having a positive, supportive culture. In other words, employees need to understand that substance use disorder is a health condition. Like other health conditions, there is treatment for it, and that they can reach out for help and get the help they need. And needs to be understood like other health conditions, not as simply as a form of bad behavior or a reason for discipline or termination. Communication needs to take place regularly, especially given the stigma associated with substance use disorder. It's really important that there are regular reminders, discussions. If there are employee groups that are in recovery who choose themselves to be public about that, that may help as well, or individuals who choose that. Obviously, an employer cannot ask anybody to do that, but people often volunteer to do that or create groups, and communicate about your policies. Here's what you can do if you have a problem. Here's how we'll get you help. Here's how we can get you back in the workplace. I think there was and I'll mention it here just because it's kind of fits in here, and that is one of the worst things you can do if you want to prevent substance use is to have extremely punitive policies. So, for example, if everybody believes that they're going to be terminated or face severe discipline or long-term negative career consequences, if they have a substance use disorder, their incentive is to hide it, not to, or potentially to try and somehow address it on the sly, and come back to work. One of the reasons for the longstanding PIMS program for commercial pilots was just that if pilots thought they would lose their commercial license, lose their career, their way of life, they would have an enormous incentive to hide an alcohol or other drug problem, thereby putting the public at risk. And this is an extreme case, of course, if they're at 30,000 feet with 300 people hurtling across the sky. But what we like to say is the same kind of thinking would apply to any employer, that if there is fear, if there's lack of understanding of the policies, the incentive is going to be to hide it, not to address it. And so that's critical because, as we'll see in a bit, the rates of untreated substance use disorder in the workforce are very high. Uh, Training and education, substance use disorder recovery and recovery literacy. ONDCP itself recently became a pilot recovery ready workplace. And one of the first things we had to do was a substance use disorder and recovery literacy training. We combined that with a stigma training. Then we also had training for supervisors on speaking about substance use disorder to and team members generally, and speaking to individual team members about potential substance use disorder problems, as well as identifying potential impairment, potential substance use disorders, linking individuals to the services and supports they needed. And Shelley, I see your hands up. Why don't we do questions and discussion at the end, and then so another key thing is benefits and resources. You know, most of us can remember onboarding at an organization and getting, probably we don't have as many binders and a lot more electronic materials these days, but huge amounts of material. You're picking a health plan, you're looking at this, there's all these different policy documents. Well, to the extent that you absorb any of it, it probably mostly slips away. So it's really important to remind employees not only what resources they have, but what your policies are, and what recourse there is if individuals encounter a substance use disorder, encounter alcohol or drug problems, and wish to seek some assistance with that. So that needs to be clearly communicated. It's also true that many of us have need to be, or excuse me, are required to have a recovery, a drug-free workplace program. So we'll talk a little bit about that as well, or similar DOT policies related to drug testing and whatnot. Those policies, obviously, we can't make them go away, and we need to have them to protect the safety. But sometimes they require discipline when other courses might be preferable, but there is discretion that we can talk about there. Health insurance benefits, wellness benefits, their employee resource groups. Does your organization offer peer support? I was amazed to find that several federal agencies already have peer specialists in place, including our peer workers or do peer support, including the Department of State, and within Homeland Security. I know both ICE and CBP have peer workers, agents that serve as peers who are in recovery themselves. This is huge, giving people another point of contact where they can feel safe in talking about some of these concerns and issues, and finding a pathway forward. Employees need to know how to access the resources available to them. Employers need to work on the language and stigma. The classic study from John Kelly, and I think it was Bettina Hopner, where they randomly divided about 500 psychologists at an APA conference into two groups, really showed something. The groups identified an identical vignette about a Mr. Williams, but one of them said Mr. Williams had a substance use disorder. The other said Mr. Williams was a substance abuser. Otherwise, they were identical. When these psychologists were then, responded to various instruments, the group that had the substance abuser vignette was more likely to assign blame to Mr. Williams, more likely to agree with punitive actions, and this despite the fact that they were trained psychologists, despite the fact that you would think they'd be somewhat immune from that. And so you see other research that shows similar, probably stronger impact in other settings, whether that be the general public or general policymakers, and how policy discussions can be framed. So other training that's important, ADA, or in the federal government, the Rehab Act, which actually protects employees who are in recovery from substance use disorder. It does not protect individuals who are currently illegally using drugs. So whether that's illegally using prescription drugs or using street drugs, they are not protected. Alcohol use disorder is a little different in that respect. That does not mean that somebody with active alcohol use disorder is necessarily fit and able to work, or that's a separate question, but they do have disability protections. Finally, a lot of manager and supervisors are critical. A recent study by Forrest Marsh group of employers of all different sizes from across the country found that if respondents said that if their supervisor told them if they had a drug or alcohol problem, they could reach out for help with it, and they'd help them get the service they need. The vast majority said they would be willing to ask for help in that circumstance. So it seems that these communications are so critical, and that's probably part of creating that psychological safety, where an individual feels like maybe the organization, they can trust their organization, has their best interests in heart, and will support them. Third pillar, hiring and employment. Hiring, obviously, you're going to be dealing with a range of things, including a history of substance use disorder, very often a criminal justice history related to substance use. So you need to look at how you're going to address that. And I think that we've made a lot of progress, ban the box policies and other things in the terms of the criminal justice end. I think the key here is being proactive about hiring people in recovery, because they can be a real asset to your organization. They can be a form of recovery capital for your organization. They can be ambassadors to employees who have current substance use disorder, or who are in the early stages of recovery. They can help change that culture and build a more positive culture. So there's great value in hiring qualified people who happen to be in recovery as well. Some employers can go so far as to say if somebody tests positive in an employment interview, they can give them a contingent employment agreement upon, say, getting an assessment, if there's treatment required, and it's possible to offer that treatment, accepting that treatment, and then following a probationary plan where maybe they're drug tested in the workplace on an accelerated schedule. Many employers can't do that, but that's an option. Get partners, as we mentioned, whether there's treatment providers, recovery community organizations, supported employment providers. There's lots of different ways where you can get a pipeline to employees who are in recovery, and especially in tight employment markets, that can be really helpful to the employer. And then looking at your drug testing. What do you do when you get a test? Assuming you're required under a drug-free workplace or a DOT regulation law to do drug testing, how do you handle that? What discretion do you have? Certainly, if you're offering a drug-free workplace policy, a key question is whether you're offering a safe harbor policy, which is, under that policy, an individual can proactively ask for help, and they're not going to be subject to discipline for having a substance use disorder involving an illegal substance. They can seek help and then have the safe harbor from that. Certainly in the federal government, that's not required of federal agencies. It's an option. For us, when we're certifying agencies as recovery ready, it's essential. What are your medical leave policies and your return to work policies? Can you make accommodations? Safety sensitive jobs. Do you have something in between that you can assign, to which you can assign an individual on an interim basis? Can you make accommodations such as scheduling flexibility so somebody can attend their mutual aid groups, their NA or AA, or go to counseling or treatment services that they need, get peer support, those kinds of things. Those are things that you need to explore also from the perspective of the ADA in terms of accommodations for a person with a disability. Pillar 4, treatment and recovery support. This is everything from your benefit design and your insurance plan, in even making sure, helping make sure that your actual plans offer coverage for mental health and substance use disorder services at parity with medical surgical services. That's been the law since 2008, but it's still a struggle. A recent new final regulation went in place from APIA to further help that, but it's going to take everybody pitching in to write that. This is kind of one of those issues like turning an aircraft carrier. It's so long been the policy to have additional authorization requirements, utilization review, this, that, and the other, or to reimburse substance use disorder services at a level which makes it impossible to maintain a decent service network. So this is something, especially for self-employed employers, this is something, or I mean self-insured employers, this is something where you can have a very direct impact. But also if you're, you know, purchasing in the market, you can look at the plans that you're purchasing from that lens as well. You can have partners, treatment providers, recovery community organizations, and others. You know, some organizations, some unions, some employers actually have arrangements with specific treatment providers, even though their coverage will accommodate other providers. They have a long-standing relationship. They've been effective for their employees. A recovery community organization could make peers available to your workers in the workplace or outside the workplace. They can refer people for employment as well. Looking at recovery support, all these other accommodations, or an employee resource group. Now that's not something, you need to have the employees who wish to start that, since that's not really instituted by an organization, but an employee resource group or affiliation group is officially recognized by an organization. I think that's important. If employees know that they can have a voice in that way, they may be more likely to do that. So I'm going to speed up a little bit because despite my saying we have plenty of time, as is my wont, I start to get a little long. So here, why adopt recovery-ready workplace policies? These are the reasons that seem most pertinent to us. Recovery. Employment is a critical form of recovery capital. That is, it's associated with higher rates of recovery, improved quality of life in individuals who have completed treatment, for example. Recovery is essential. Employment is essential to be able to have a roof over your head, to be able to contribute to others, to society. Also, if you're familiar with Maslow's hierarchy, if you're worrying about whether you're going to be able to pay the rent or have a roof over your head, or if you're going to be able to eat, you don't have a lot of time to think about how to live a life in recovery. You're just trying to survive. The other point we make is substance use disorder in the workplace is common and costly. In 2023, over 30 million American adults with substance use disorder were employed. And of these, nearly 80% worked full-time. So we say to employers of any size, you have untreated substance use disorder in the workplace. One of the things you need to understand about substance use disorder is that it's a broader category than addiction to alcohol or drugs. Substance use disorder can be categorized, like many other conditions, as mild, moderate, or severe based on the number of diagnostic criteria met. So while many of these 30 million are mild or moderate substance use disorder, that's when you'd like to be able to intervene rather than when it's a severe chronic condition. It's like only dealing with, historically what we've done is kind of akin to only dealing with heart disease after a heart attack, as opposed to dealing with it beforehand by treating high blood pressure, working on cholesterol levels and those other factors. But also a significant portion of these individuals do have severe substance use disorder. So that's not a non-issue at all. The estimated average annual cost of employees with untreated substance use disorder, and this is from 2017, so you can be sure the costs have gone up from 2,700 in alcohol in agriculture, excuse me, to close to 14,000 in the information and communications industry. And a 2021 CDC study looking at 2017 again found that opioid use disorder and fatal opioid overdose alone cost the United States economy over $1 trillion in 2017. I think we could be fairly confident that hasn't gone down since then. So we also say that if you help employees find recovery, if you build the resources they need, you're going to save money. So it makes sense from a business sense. You're going to, again, the same study, 1,200 in agriculture per capita savings annually, to 8,500 per capita in the information and communication sector in 2017 estimated. The Flight and Alcohol FATAP, the Flight Attendant Drug and Alcohol Program, which covers flight attendants from airlines across companies, found that their average airline employer saved $780 per participant per month for employees that had an alcohol or other drug use problem for flight attendants and joined the program, got in recovery. That has to do everything with scheduling, that has to do with safety procedures, et cetera, et cetera. And again, as we mentioned, people in recovery can be among the most motivated and dependable workers. So this is not simply the right thing to do. As we said, it makes good business sense. It also, if you get certified as a recovery-friendly employer or recovery-ready employer, that's kind of a mark that you're a good corporate citizen and that you're helping the community address one of the key concerns it has, opioid use disorder addiction, and you're helping be part of the solution. That's good. That's good corporate messaging. Makes a lot of sense. In addition to being the right thing to do. So, and before I get on to certification at federal workplaces, I will say that when we released the toolkit, which was in November of 2023, New Hampshire Governor Chris Sununu also announced through the same press event that the launch of a National Recovery-Friendly Workplace Institute. That institute is up and running. We have a representation from the institute I see on this webinar today, and that is huge. They are working with multinational corporations that don't fit so well into the state recovery ready workplace or local government recovery ready workplace initiative framework. They're also working with states and local governments to help them build initiatives. That's really important. We also announced the development of a model state act that you mentioned, Diane, at the beginning, and that was in the bio there. That has now been adopted by the state of Colorado as the model for its state law that launched its recovery-friendly workplace program. There's a lot of movement that came out of this, and one of the toughest things has been trying to get this ball rolling in the federal government, because it's so critically important that we not be in this position of saying do as we say, not as we do. So we need to be able to implement this within the federal government. I'm pleased to say that ONDCP is a recovery-ready employer. I'm pleased to say that the Substance Abuse and Mental Health Services Administration is now a recovery-ready employer, and that other federal employers will be coming online. We're doing a piloting process right now, and we have developed interim certification criteria for the piloting process, more comprehensive certification criteria also on hold for an eventual government-wide sustainable approach to that, which would involve OPM and other stakeholders working across federal government. So more to come on that. like other employers, some of the key elements are having a recovery ready or recovery friendly workplace statement or pledge, however you want, or commitment, statement of commitment, however you want to describe it, that says what it means that you're a recovery ready workplace. That describes that clearly, both to new employees, it should be part of your onboarding package, to current employees, it should be disseminated to all employees, and to the public. It should be on your website or other open forums of communication to say XYZ Corporation is a recovery ready or recovery friendly employer. And that means, and actually that has been posted to the ONDCP website, that statement. You have to have reviewed your policies and updated them as possible. Now, many of our policies are really kind of set in rule, but then there's latitude within the pillars of the rule. For example, even under the drug-free workplace program, if somebody tests positive and they haven't reached out for help, or they reach out when they learn they're going to get tested, according to the rules of that program, they must have discipline. Then you must take disciplinary action. But it doesn't say you need to terminate them. It could be a letter of reprimand along with support for getting them into treatment, for example. So there's different degrees of latitude. So how do we exercise that? Those are some of the policies that we look at. Training managers and supervisors. Again, we talked about this. We did this at the federal government, as I mentioned before, on speaking about substance use disorder, identifying potential substance use disorder, making sure employees are aware of policies, and language guidance. We are in the process, as I mentioned, of developing this language guidance. As an interim measure, we're using the NIDA Words Matter document, which is going to be close to what we're developing, but not quite as comprehensive. In addition, to be certified recovery ready as a federal workplace, you need to have naloxone available in your workplace. It needs to be set. Employees need to know where it is. They need to be trained in its use, trained in the identification and response to potential overdose, including through the administration of naloxone. And you need to have a plan or a strategy for hiring people in recovery, whether that be through partnerships with, say, a supported employment initiative, for example, from VA, or from a individual placement and support initiative in the community. And you can also use certain federal specific authorities, such as Schedule A Disability Authority, which allows you to target certain people that qualified, provided they're qualified, and get them on board much more quickly in a much more expedited manner than would be possible otherwise. So ONDCP and SAMHSA have become recovery ready employers. I've pretty much covered everything on this slide, so I'll move to the next one. Just last week, we had a celebration. We called it Recovery in the Workplace, Investing to Build the Workforce of Tomorrow. This included some of the companies that have become or are becoming certified by the recently launched National Recovery Friendly Institute, as well as some employers that are certified by state or local initiatives, some of which we're also looking to obtain the federal certificate, or not federal, but the national certification, which frankly is a little bit more rigorous than most of the state models. The state models tend to generally be intentionally designed to have a fairly low bar of entry to get employers on board and then start the motion towards adopting more and more recovery-ready workplace policies, whereas the National Recovery Friendly Workplace Institute starts with a pretty comprehensive look at what you need to have in place to be a recovery ready or recovery friendly employer. However, given that it's focusing on major corporations, states, or larger companies, et cetera, some of that makes sense. These are organizations that tend to have the kind of resources in place to make those transitions in a more expedited way as well. So, but at our event, we had labor groups, unions, we had employers, we had representatives of the Institute. They shared about their lessons learned, their experiences becoming recovery ready, recovery friendly. And the group was so enthusiastic. Everybody said afterwards, we have to stay in touch with each other. We have to keep sharing ideas. There's momentum here. And one of the things, that we mentioned to them is there is, of course, a national community of practice that is hosted by the National Recovery Friendly Institute. So that's one potential venue or platform that groups could use to further to dialogue with other companies and get peer-to-peer support. So here is a screenshot of the Recovery Ready Workplace Resource Hub, the toolkit, and the model state law with links to them. The hub still needs some work. We're back and forth. I will say the search button is not going to be is not that effective right now. We're working with them to address that and some other issues, and we have some updating we need to do in terms of new content as well and new links. But it's certainly a fairly comprehensive resource. I don't think there's anything that approaches it out there in terms of recovery ready / recovery friendly workplace policies, links to state initiatives, links to resources, and so forth. On the national landscape, there was a 2023 survey by the National Institute of Environmental Health and Safety and the NIOSH, CDC NIOSH, the National Institute on Occupational Safety and Health, which you're probably all familiar with. And they identified 31 recovery-ready workplace efforts or recovery-friendly workplace efforts in a survey of 33 states. So in the remainder of the states, they weren't able to reach somebody. So that's already a limitation on what was there. In 2024, ONDCP was able to identify earlier in the year 40 efforts, state level efforts in various stages of development. Only about 20 of them were really fully statewide, initiatives sponsored by the state. So we count when we implement our national drug control strategy. We also set some quantitative goals. One of the quantitative goals is the number of state-led recovery friendly / recovery ready workplace initiatives. Why is that? That is because if an employer says they're recovery friendly or recovery ready, we don't know what that means. If they're certified by a state program with clear criteria, we know what that means. If there's an initiative there, we know that they're going to be able to certify many different companies, and we're also fairly confident that what we're counting is legitimate. So that's our measure for success in the National Drug Control Strategy, is the number of recovery friendly workplace initiatives at the state-led ones. But that doesn't count county-led ones, some of which are very good. And it certainly doesn't count the subsequently developed National Recovery Friendly Workplace Institute, but that's working on a different scale as well. So we did the landscape analysis. These are a couple of resources that are out there. Again, the QR code will take you to them. So the Institute was launched, and at that event, Google committed to becoming a recovery-ready workplace. And we have many significant corporations and unions that are now moving forward, working with the Institute. Potential partners as you're doing this as an employer. States or provinces. In Canada, we have some motion in Canada. Local governments, trade or industry groups, unions, chambers of commerce, other employers who are also grappling with these issues and implementing, especially if they're in a similar industry with similar constraints and opportunities. Treatment providers can help you find employees. They can also help you address substance use in your workplace. Recovery community organizations, key partners for some of the same reasons. Others, individual placement and support or other supported employment programs can be key initiatives. I love IPS because it's competitive employment. It's trying to get people, it was traditionally primarily for people with severe mental illness, but it is subsequently, there's been a growing research showing it's effective with other disabilities and conditions, including substance use disorder. VA uses it extensively. They have it in all their substance use, in all their networks for substance use disorder services now. What the beauty of it is, the employment specialist develops relationships with a cadre of different employers, government employers, private sector employers. And then when they have individuals that might be a good fit, they approach the employer. One of the selling features is they get not only the individual who they're hiring, but they get the employment specialist for as long as it takes. There's no time limit on that service. So you get both the employment specialist to help make sure, and their job is to make sure that it works for the employer and it works for the employee. And so they're there to troubleshoot those issues. And incidentally, if you have some other openings where you need people, that employment specialist could help with that as well. So I see that as something that's still relatively new in the substance use disorder arena, well established in the mental health arena, but a key opportunity moving forward. Key components, if you want to have a quality recovery-ready workplace initiative, clear standards and criteria. Certification, consultation, and support is really critical. If you give people links to a toolkit and some resources, it's going to be limited what they have the bandwidth to do. If you can bring someone in who can help them review their policies, who's done this multiple times, who can help them check the different boxes and create a plan to move forward, because how that implementation takes place in one organization will differ from another. How far one organization can go may differ from how far another. Branding is really important. What does this mean? It's really important that, for example, in New Hampshire, an employer can put up this recovery-friendly logo and tell the community they're a recovery-friendly employer. That's good for the community. It's good for the employer. And certainly, I think it also may help them find more people in recovery who want to work with them. So peer-to-peer consultation, as I talked about, not peer recovery support, but rather business to business, that can be really helpful, or union to union, or union to business, or business, whatever. All these kinds of support make a difference. And then one thing that we haven't gotten very far on, but that could make sense, is a tax incentive or other incentive. A couple states, New York and Illinois, have put in place a tax incentive for hiring people in recovery. Last I heard, the uptake was not great in New York. I'm not sure where it's at in Illinois. I think one of the challenges there is that it gets very granular and it becomes a lot of administrative work for the employer. And how do you document who's in recovery and who's not? And do they have to have been in treatment and all these other things? And then it becomes, is it worth the effort to even pursue the tax incentive, I think. So one of the things we recommended in the model state law was a simple tax incentive for becoming certified. So if you're certified, you get a tax incentive of X amount, period. And that saves the employer a lot of administrative work, saves the state a lot of administrative work. We've heard other incentives that have been used, reductions in workers' compensation premiums. I don't think anybody outside the back office really notices that or perceives that. I don't know how cogent that is as an incentive versus something more directly related to the activity itself. So that would be my view. So that's what I have for today. I'm open to your questions. Again, I can't see the chat, unfortunately. That's disabled at our organization. Feel free to reach out to me if you have questions in the future. And with that, I'll pull down my my slides and look forward to questions, discussion.
Peter, thank you very, very much. I thought this was a really great overview. Might take a little unpacking, but I think we're going to make the recording available. We've also developed a one-page policy brief to guide you through things. I have questions that have come through, but I see Tara has her hand raised. So Tara, if you want to go ahead.
Yes, thank you, Peter, for the information. Let me put my hand down. So I work in the agricultural occupation, and so many of those are going to be small to medium sized business employer.
Right.
They also, many times, 90% of the U.S. farms are family-owned farms. So they're working with family members. is the website or the toolkit going to provide any guidance when your employees are family members? And is there any guidance for the smaller business owner in a stepwise fashion of how they could start implementing in small steps? Because I could see how a smaller, medium bit would think, oh my God, this is a lot. And are any of them getting tax incentives when they're small?
Yeah, so I can't respond to the tax incentive because I don't know the data on that, but what I can tell you is that we do emphasize that this is a staged process. It's not an all or nothing process. And particularly most of your state certifications will work with you like, let's identify a policy we're going to do right now. And then you'll get certified for the year. And then let's look in maybe next year if there's another policy we can take on or another change we can make. So they'll work with you to stage that process. I have not seen resources specific to if your employees are your family member, which creates a whole other dynamic. So I think some of those are become more directly clinical as well as, how do you as a family address this, as well as how do you as a business address this. So I think that's obviously much more complicated. I'm familiar with that in that my wife's family owns a small business about 100 miles southwest of Chicago, and a third of the employees are family members. So that's a totally different world. But I'm not familiar with resources specific to that. If anyone else is here, obviously, please let please speak up. But I do, yeah, we do say stage it, and we do say that if you can't, you may not have an EAP, you may not even be able to provide insurance to your employees if you're really small. And you may not be over the threshold size where you have to. So in that case, that's where we talk about, that's why we talk about treatment and recovery support as opposed to what are your benefit packages and what is your EAP. Because for most employers, that might be what it looks like, but for a small family farm, it might be, there's a good treatment organization in town or in the next town. We work with them. There's a recovery community organization. There's a recovery residence, a good quality recovery residence. We work with them, so it can be those kinds of partnerships.
Just to build off of that, Peter, I think Tara mentioned in the chat too about the importance for community-based or programs where you start with the residential treatments and you move up and you partner with them together there. I think that's really a good avenue for these rural areas and small businesses to get involved with that. But I'm curious if you or if anybody else has an idea of, would this look different for employers in rural areas as far as what's available or compared to urban areas? We do know we have a lot of small businesses in our rural areas. So I'll throw that out there as a general question. I don't know if you have thoughts on that or if anybody else wants to put them in the chat.
I'm certainly willing to, we know for a fact that, resources are much harder to come by in rural communities. Also, if there is a resource in your community and you park your car out in front of the treatment provider, everybody knows that Bob's car is parked out in front of the treatment center, so there's that whole dynamic as well. So if the community isn't real safe and welcoming for that, that's going to be another impediment as well. Or do I go 80 miles over here? All of these factors play in, but really you look at it, whether you're talking about residential treatment, whether you're talking about access to medications for opioid use disorder, whether you're talking about recovery residences or recovery community organizations, any of those things, they're much harder to come by in rural communities because the population density makes it harder. years ago, I worked with the state of Illinois, and we had a rate-based system, but we had to have a special supplement for rural communities because there wasn't enough traffic to keep the facilities open and solvent, but we had to make them available. So it is a different world when you get out into the rural communities.
So thinking about how rural communities try to overcome their limited resources by working together. And think about disaster preparedness is a great example where you have people who wear different hats and different roles, So I think that maybe modeling something off of that might be a good approach. Certainly you need to start with the stigma reduction. There needs to be education on, what this looks like and why it's important. But this is also a way for those employers who are struggling to find workers to overcome that challenges.
Absolutely. There's one employer that took part in our event last week that I happened to meet their HR director. I was speaking at a conference in Michigan, and they're in a very rural community. Well, they are hiring people in recovery and helping them stay in recovery. They need the employees, and it's really good for them and for the community. They actually purchased a motel to use that as transitional housing for their employees in early recovery to give them a safe and supportive place to live. So they're doing creative solutions of those kinds that, and it's specific, because if they can't get their needs met there, they're going to have to go somewhere else. And if they can't
Exactly.
get the help and support they need there, they're going to stay there.
So I want to go to a couple of other questions that came in. I think, construction industry, we work a lot with partners in that area. And I think that's an avenue where there's a lot of questions because it's a safety sensitive industry. You often have a drug-free workplace policies in place. What would this look like? And, is there any recovery-friendly program that's working in there? I see that Kathy Hartnett put something in the chat about that the Recovery-Friendly Workplace Institute is working with business associations such as ABC, who is mostly large small building construction companies to help with them. And I know that Kathy Utter also talked about LIUNA's program that they're rolling out. And I would give Kathy or Kathy, gosh, two Kathys there.
Give them the floor. Yeah, I'm a little bit familiar with one Kathy, but I'd like to also learn about the LIUNA, which I'm not as familiar with. So.
Yeah. So if either of you want to say anything.
Sure. I'll say from the Recovery Friendly Workplace Institute, one of the things we discovered is that one of the ways that business associations are getting involved in all of this is creating programs with our help and others for their members to encourage their members to become recovery friendly workplaces, often which are small businesses or family owned businesses. And I think one of the things, Peter, you always talk about, which I think is so helpful to people, is that becoming a recovery friendly workplace, the way our national certification works is you get points. You have multiple ways you can become a recovery friendly workplace. And one of the concerns of small businesses may be that they don't have big benefit packages. So they're limited. So those community resources are very important. Another one is they have a contract that requires them to be drug free, or they have a contract that requires them to do drug testing. Nothing that is you can become a recovery-friendly workplace and work around those things. The federal toolkit is not asking anybody to violate a law or a contract that they have with those. And so over time, we'll keep working at this and figuring out how to do it. The National Drug and Alcohol Screening Association has become a recovery-friendly workplace, and they are working with their members to have very serious conversations about drug testing and when is it appropriate and when is it not? And we're excited about that because they're being fearless about sort of taking on what is a complicated topic. I mean, we have people who say, well, why would you drug test me if I'm not exhibiting any reason for you to do so? Or there are other places where they have to drug test because of some kind of a contract. How can drug testing be a place that be used in a way that supports people in recovery or seeking recovery and isn't just a weapon to get rid of an employee. So
Or
those are the
even
kinds
if
of
it isn't,
conversations.
and even if it isn't intended as a weapon to get rid of an employee, it can create fear, but certainly it's required for safety sensitive positions. There needs to be usually some form of random or periodic drug testing. Um, and whether that be under the drug-free workplace program or whether that be under the DOT requirements or even stricter, the Nuclear Regulatory Commission. So there's a huge portion of the workplace that if you have a federal contractor grant, you are pretty much going to have a drug-free workplace program unless you're regulated under the DOT regulations.
So two other industries that have come up. One is school districts, and then the other is a comment from Matt Clune, who says, excellent presentation, Peter. Very comprehensive. And he wants to talk about employer participation and moving the movement forward within the federal government. So school districts and federal government.
School districts, that's a good question. I think it's critically important that they adopt these policies. I personally don't have much knowledge of where school districts are at. I have my suspicions of where they may be, but I don't want to speak based on that without having actual knowledge. I have not done outreach to them specifically, so that is an excellent point that we should think about. In terms of school districts as well as institutions of higher education. Especially if they are supporting their students in recovery through a collegiate recovery program, counseling services, and so forth. What are they doing with their faculty and staff? How is that? Is this a different songbook? I mean, it shouldn't be exactly the same songbook because the relationship is different, but the same principles should apply.
Mm-hmm.
And then
Yes.
Matt, I forgot the other portion of the Matt's question there.
Just about moving it forward within the federal government.
Hey, Matt.
Do you want me to?
Sure.
Hi, folks. Hi, Peter. Really wonderful presentation. And it's been a minute since I was fully immersed in all of this, and it's amazing to see all the tremendous work that's being done both by the federal government and from the bottom up, grassroots. One of the things I'm left with was a challenge for me when I was trying to pitch recovery ready or recovery friendly workplaces to corporations was getting buy-in among employers. And I was quickly reading through the NIOSH sampling, and I noticed that nearly every state listed employer buy-in as a challenge. Naturally, right?
Yeah.
We all know it who've been there. So the tax incentives to me seem to be, and you had mentioned also getting kind of like one tax incentive for just for a corporation, not having to count head by head for those they hire in recovery, seems to be the way to get employers to begin talking at least. And so for me, one of my takeaways is I was familiar with the New York State tax incentive, not the Illinois one, but I want to find out a little bit more about what they did within those states to get that through the legislature. How is it working, et cetera? Because I think the more, at the end of the day, I hate to be cynical about all this, as much sense as it makes to all of us, because we've been there, done that, and can see the benefits and how much dollars are hemorrhaged by corporations. Getting employers to take that step to train up their staff and to, morph their culture into one that's more recovery friendly is a huge challenge.
That's
still
why I
today.
think consultation is so important. You need to be
Yeah.
able to help with that.
Big TTA center. Maybe SAMHSA will fund it.
Yeah, I think
Anyway.
the kind of New York, probably the model for the New York and Illinois incentives might be something like the work opportunity tax credit, where, you can hire somebody who has a history of criminal justice system involvement, et cetera, certain targeted populations, and get a tax credit. I just think the recovery, substance use disorder recovery population is particularly, how do you document that? I think that's difficult. And I also just think that a simple incentive for being certified would probably have more uptake and more impact. I do know that when Colorado adopted our model state law they didn't adopt it lock, stock, and barrel, but they used it as a model for the template for theirs. A lot of the same terms and conditions, so forth. But one element they did not include was the tax incentive. And so I've heard, Colorado stakeholders saying, that's something we really want to get, is that employer tax incentive. But that
I'm going to do more
fell out of the
research.
bill fairly early in the process, I guess, whatever, It's always.
And then I'm sorry, Peter.
Go ahead.
Yep.
No, go ahead.
Just very quickly, I was just going to add, and may regret doing so, but now that I'm with HHS, at least, getting, rather than talk the talk, walk the walk, as you said earlier. Wonderful to hear that SAMHSA's, you made progress with SAMHSA. I'd be happy to help out on that initiative with federal government, starting at home with HHS.
Well, let's get in touch.
Well, I'm going to hate to stop the conversation, but I want to thank everybody for participating. We have put together a one-page workplace policy brief on this topic. It gives some highlights from what was presented today and some tools such as a cost calculator and also an assessment tool that is part of the toolkit, which is actually a really great place to get started. And we'll send this out along with the recording after the meeting. And I think we've also mentioned some of the resources that are available from the National Recovery Friendly Workplace Institute. And since we are Federal Region 7, we do want to give a shout out to the Recovery Friendly Missouri state-based program. And then I put in the chat that we do have pilot funding available, and this is for organizations that serve multiple employers in Federal Region 7, so Iowa, Missouri, Nebraska, and Kansas. So the link is there, reach out. And just to remind you that our fabulous outreach team with the Healthier Workforce Center has developed a lot of great free resources you're welcome to include. And you have the links here, but we're happy to send them out. So with that, Peter, thank you so much. This was very informative. You can't see the chat, but lots of positive feedback on the quality of the presentation and your knowledge. And we really appreciate your taking the time to join us today.
I really appreciate your reaching out to have this discussion, and I am really excited to see what you're doing through your center. So thank you.
Thank you. We'll just keep the conversation going.
All right.
Have a good day, everyone.
Bye now.